Okay, good afternoon, everyone. I'd like to welcome you to today's coffee hour. We have the pleasure of listening to Heather Sandison. Heather was born and raised on Oahu. She is a 2000 graduate of Kahuku High School, where she was valedictorian, and she was educated at San Francisco State University and Bastyr University in Seattle. Currently, she is the founder of the I never can pronounce it. Solcere Health Clinic and Marama, the first residential care facility for the elderly of its kind at Solcere. Dr. Sandison and her team of doctors focus primarily on supporting patients looking to optimize cognitive function, prevent mental decline, and reverse dementia by addressing root causes of an imbalance in the brain and the body, including toxins, nutrients, stress, structure, and infections. She was awarded a grant to study an individualized, integrative approach to reversing dementia and is a primary investigator on the, I can't even begin to pronounce this acronym, clinical trials the results of which are in peer review for the Journal of Alzheimer's Disease. At Marama, Dr. Sandison has created an immersive residential experience in the lifestyle proven to best support brain health. After an 18-month wait list, Marama is expanding to a second location in the Midwest, opening on April 3rd of this year. She is also the host of the Reverse Alzheimer's Summit and Collective Insights podcast, which she works to share where she works to share what is possible for those suffering with Alzheimer's.
Thanks, Dad. Thanks so much for having me back. It's a real pleasure to be here. I'm so excited to share with you because even since I last presented to the Hawaii State Bar Association, I've learned even more about how possible it is to reverse cognitive decline. And unfortunately, people are still told if they see a neurologist, it's one of the most heartbreaking parts of these stories around Alzheimer's. People go to the neurologist when they're noticing that cognitive decline, and they're still told there's nothing you can do, or try these meds. They don't work very well. Put your affairs in order. I'll see you in 6 months to measure the decline. And yet I see over and over and over again that it is possible to reverse cognitive decline, and it's almost overwhelming how much there is that you can do about it. And when we're in prevention mode, which I would expect most of you are, it is even easier to optimize cognitive function, and you can do less and it costs less to get that optimal cognitive function when we're not having to fight back from decades of decline. So I want to talk through the stages of cognitive decline because this helps to kind of orient us. I'm sure you're showing up here because you are in the pre-symptomatic stage. You haven't started to notice that you're having any decline. Or if you're in that subjective cognitive impairment stage, that second stage, this is when it's relatively easy to do something about it. This is the absolute best time to start preventing cognitive decline, because what we've learned from the data, from the research that we've done, is that there can be brain changes happening. We can have inflammation, we can have these modifiable risk factors putting our brains at risk well before we can measure the decline. And for a group of attorneys, you have cognitive reserve is what we call it. So you have graduate degrees, you're well educated, and you have some extra. So we might not catch on something like a classic MoCA score or a SLUMS or a mini mental status exam that a primary care provider might give you. If you complain of cognitive decline, we might not catch that there's anything measurable happening. You can just tell that maybe you're not remembering names you would have 10 years ago, or you can't remember where you left your keys, where you put something down. If you're starting to notice that it's taking more effort cognitively, this is the time to take action. Now, some of you may also be in the position of caring for someone with Alzheimer's or dementia, and they might have mild cognitive impairment. This is already late stage Alzheimer's. This is pretty advanced. And this is after the pathophysiological process in the brain has been happening for a long time, yet we label it mild. This is a misnomer. This should not be called mild. This is like saying you have stage 3 cancer. It's not stage 4, so it's mild. This just shouldn't exist in the vernacular. And yet this is also a place where we showed in my clinical research, which I'm hoping will be published very soon, and also in Dr. Bredesen, my mentor's research, that this is also a place where we can get reversal of disease. Final stage Alzheimer's is awful. It's stressful. It is heartbreaking for both the patient often, and then also for their loved ones who are saying that long goodbye that comes with the dementia diagnosis. And this, we have seen miracles happen. We have seen some reversal of the disease process, and our patients improve quality of life. But it's much, much harder to get that. And we don't want to wait for that moment that we're losing activities of daily living, dependent on others, and worst of all, losing our dignity. And so I want to talk about all of the things, the fun things, about why it's possible to reverse this irreversible disease and why it's absolutely important to start taking those preventative measures right now. So there's foundations, these are foundations of brain health, and we don't have time to go into all of them deeply, but I want to give you the highlights and the really actionable things that you can do to start today to reverse any cognitive decline or just optimize cognitive function so you can show up at your best every day feeling alert and able to focus and able to get the most out of your career, out of your family life, out of life in general. So let's talk about nutrients. The science, I'm a fan of the ketogenic diet for brain health, and this is some of the latest science. This came out in January of 2022, a little bit over a year ago. And this was just a small trial. There are much larger ones, but it was so illustrative of the change that we're seeing in the science when it comes to implementing a ketogenic diet. So with just 6 weeks of being in ketosis, 8 participants got into ketosis for those 6 weeks. And all of them had a measurable, demonstrable, significant improvement in cognition in just 6 weeks. So this is a very simple study, just 6 weeks, 8 people, they all got better. And these were people like probably in your state where they didn't have Alzheimer's, they weren't diagnosed with Alzheimer's, but they still had this improvement in cognition. Now, there are large meta-analyses with hundreds and thousands of patients that show similar things. And that's part of why I included a ketogenic diet in my clinical trial. And what we saw in my office when we were doing this is that the higher your ketone levels, the bigger the change in the measurement of your cognitive function. So if you can get a ketone level of about 0.5 on blood ketones, you're kind of in mild ketosis, 0.5 to 0.9. And when you can get it up over 1, you're in solid ketosis. And when you can get over 2 and even over 3, you get even more alert, more energy, more fuel in your brain. And there is a keto diet guide. So I'm not going to go into all of the details. I could spend a weekend talking about the ketogenic diet. But there's this keto diet guide that's available on my website, on the solcere.com website. And then also Desmond is going to help by sending out a PDF so that you can either get it by email from us or you can get it from Desmond. So the goal here is to change your metabolism. So I hope I've convinced you. The science suggests that ketogenic diet is good for your brain. We don't need you in ketosis for the rest of your life, but for 3 to 6 months, you get the brain healing benefits of a ketogenic diet. So what does that mean? It's not about healthy foods and unhealthy foods so much. It's really about the goal of changing your metabolism. So what we need to do is restrict carbohydrates significantly. And we want to do this in a very healthy way. And we do it by having a vegetable-rich diet that's also high in fat and protein. And we restrict those carbs, typically 30 to 40 grams. There's some very healthy people, very lucky people out there, excuse me, who can limit their grams of carbohydrates to 50 so they can get away with having a little bit more. Most people need to restrict it to about 30 grams of carbs and then measure those ketones, make sure you're getting there. The first couple of days can be a little challenging. You can go through something called a keto flu, but once you're on the other end of that, your appetite usually goes down. You don't have as many cravings, your alertness goes up, energy levels go up. cognition improves, and typically people sleep better at night. You get off the highs and lows of the sugar roller coaster, and so that you're less irritable and typically have better mood. Most people want that. So I would encourage everyone to try it. In prevention mode, like for myself, because I don't want to get Alzheimer's, I go into ketosis every 3 to 6 months for about a month to 6 weeks. And I personally notice that I'm awake at 5 a.m., ready for my day, where when I'm not in ketosis, I'm struggling to get out of bed at 6 or 6:30. So I get an hour and a half back in my day, and I experience the better mood, better sleep, and better cognition. So regardless of where you are on the cognitive spectrum, you can get benefit out of this right away. A couple things to keep in mind. So what's happening with the ketogenic diet is that what we're doing is we're using an alternative fuel source. Instead of using sugar for fuel to generate ATP or the fuel our cells run on, we are using ketones or fats. So fats become ketones. And we can use MCT oil or coconut oil. Coconut oil is very high in these medium chain triglycerides or MCTs. We want to have plenty of cholesterol, especially as we age. So I know we're always hearing how bad cholesterol is, but I would encourage you to keep that cholesterol level above 150, that total cholesterol number, because it's really important. It's the backbone of our sex hormones and stress hormones. And it's also necessary for any healing, for any wound healing. So if we're having a surgery or we cut our foot or our hand, we need that to heal. And cholesterol, it's very expensive to make. We want to have enough of it, and then we don't want to have so much of the bad cholesterols, your oxidative cholesterols, or your really small density LDLs, or your Lp(a) or your ApoB. Those markers you don't want elevated because they put you at risk for cardiovascular disease. They also clog up your arteries, which affects blood flow to the brain. Omega-3s are another really important fat. These help to reduce inflammation. And many people describe the progression of Alzheimer's and other dementias as being essentially triggered by inflammation. So we want to reduce inflammation, and omega-3s or fish oils really help to do this. We also need plenty of protein and plenty of amino acids. Those amino acids are the backbone of our neurotransmitters. You probably heard of tryptophan, right? Like Thanksgiving, you eat turkey and you feel sleepy because tryptophan becomes melatonin, and it also becomes serotonin. That's how it makes us kind of sleepy. Other amino acids like GABA, glutamate, glutamine, also tyrosine. Tyrosine is the backbone of our thyroid hormones, and dopamine. So these neurotransmitters are made out of the building blocks of protein and amino acids that are found in typically animal proteins, but you can also get them from plants. So we want to have enough of these and a robust amount when we're going into ketosis and when we're looking for that improvement in cognitive function. Now, carbohydrates, too many of them are certainly going to keep us out of ketosis, and way too many of them, especially over time, is going to lead to diabetes. One of the ways that we know we can get Alzheimer's is by having high levels of blood sugar. Blood sugar and insulin at very high levels in the brain make it hard to create sugar, create ATP out of sugar, out of carbohydrates. So I'm using the terms sugar and carbohydrates kind of interchangeably. Anything that raises your blood sugar, things like pasta, bread, rice, yes, unfortunately rice, but also seasonal fruit. These things can all raise your blood sugar. And if we're having that in addition to candy and soda and other things that are going to raise our blood sugar, and we have that prolonged over time, it creates a glycosylated end products and other toxins that are associated with triggering that inflammation in the brain associated with Alzheimer's. And so this is why sometimes you'll hear Alzheimer's called type 3 diabetes. That's not for everyone who has Alzheimer's, but for many of them. So certainly having diabetes is a risk factor for progressing to Alzheimer's. Now, some of you may have heard a term called ketoacidosis. So when we get into the ketogenic diet, we are not worried about ketoacidosis. Ketoacidosis is an emergency situation, and it's a very pathological process that's associated with certain types of diabetes, particularly type 1 diabetes. So that's not what we're talking about. We're talking about a very healthy metabolic state of going back and forth from burning fat for fuel, being in ketosis, and burning sugar for fuel or carbohydrates for fuel and being in glycolysis. That metabolic flexibility is what we're looking for and what protects our brain. Okay, so the next foundation of brain health, structure and blood flow. Last time I saw you guys, I did not talk about exercise, but I felt like this is a great opportunity. Everyone knows exercise is good for us, and what really we need is the motivation. So I want to describe the 4 types of exercise that get us the most benefit for our brain. And usually a combination of these 4 is what's ideal. And this is what we provide for our residents at Marama. So aerobic exercise, many of you are familiar with this. This is just getting that heart rate up. You want to get into this target heart rate zone, which is if you take the number 220, subtract your age, which say you're 67 years old. If you take 220 minus your age, that gives you about 173, I think it should be. You can check me on my math. And then multiply that maximum heart rate by 0.75 and then 0.85. And if you're 67 years old, that gives you about 115 to 130. So 75 to 85% of your maximum heart rate is your target heart rate. And that's where you want to spend about 150 to 200 minutes per week. So this can look like cycling, biking, rowing, a Zumba class. You might want to wear some sort of heart rate monitor for a couple weeks and make sure you're getting into that target heart rate zone. Again, it's 75% to 85% of your maximum heart rate, and you calculate your maximum heart rate by just taking the number 220 and subtracting your age. We're going to also have an activities handout available in the next week or so. So if you go to that website, my Solcere, SOLCERE.com, well, that'll be available and I'll have all of that in writing. So the exercise types are aerobic, which you want to aim for about 150 to 200 minutes per week. And then strength, this is building muscle. So muscle sends signals like brain-derived neurotrophic factor, also testosterone, sends signals from the muscle. There was a recent study that reclassified or proposed reclassifying muscle as endocrine tissue or glandular tissue because it sends so many signals to other places in the body. It's not just connective tissue that allows you to lift your child or grandchild or get up out of bed or out of the chair. It actually sends signals to your brain that can tell your brain to grow, to create new neurons and new connections between neurons that equate to being able to remember your neighbor's name. So strength training is really important. And the way to know if you're doing enough is, are you building muscle? If you're building muscle, you're in good shape. Strength training is going to be helpful because not only is Alzheimer's and cognitive decline a big risk with aging, but so are falls. Falls can be very debilitating and can be that kind of that final thing that happens before someone really goes downhill. I'm sure many of you have seen this. Someone breaks a hip and they never fully recover. And so keeping that strength up, keeping your muscles strong is really important to a long and healthy, well-lived life. The next one I'm really excited to share about is the combination of cognitive and physical exercise at the same time. I'm going to go into more detail about that in a minute. The other one I want to introduce to you is contrast oxygen therapy. This is where you actually go from concentrated oxygen at about 80% down to negative oxygen at 8%. What we typically breathe day to day is 20%. And so what we're doing, it's almost like, and I don't know if many of you might remember the 1967 Olympics, the Olympians went up to altitude in Lake Tahoe to train. And that was so that they would get this feedback from their body to create more red blood cells. So it was a stressor on the body that created this response so that they had more adaptability and more, they were basically able to perform athletically at a higher level. We're doing something similar, but you don't have to go to Tahoe, and we'll get that same benefit of stressing the system a little bit to create more resilience. So exercise from the science, among patients with dementia or mild cognitive impairment, when you look at meta-analyses of randomized controlled trials, this is at the very tippy top of that hierarchy of how we look at the science. So in the best trials, when you put them all together, what you see is that after 6 to 12 months of exercise, those who are active are doing better than those who aren't. And so this is measured over and over and over again in the science. And this is one of those meta-analyses that looks at lots of different data sets, lots of different papers, and puts them together. You just can't argue with this science. It is so good. I wish what we could do is bottle exercise and that you didn't actually have to make time to do it. So what do we see? When we look at this in more detail, healthy adults, so even those without cognitive decline, have improved cognitive scores. And then those who are exercising have larger hippocampal volumes. The hippocampus is a seahorse kind of shaped part of our brain that's responsible for memory. They also have measurably better spatial memory. And we're seeing improved connectivity when we do brain mapping after 6 to 12 months of exercise. And there's a handful of proposed mechanisms, including exercise facilitating neuroplasticity. This is that, like plastic, we think of it's moldable, it's changeable. And what exercise does is it gives us that ability to rewire our brains to create those new connections. And so there's also, you're reducing the risk of stroke, and we're getting a neuroprotective effect, we're getting hormonal signaling. There's so much, we're getting, of course, blood flow, increased blood flow to the brain. All of these benefits come from movement. So it's a no-brainer, pun fully intended, it's a no-brainer to start exercising. All right, so this is the new one. This is what I want to introduce you to today. This is the combination of cognitive and physical intervention, cognitive and physical exercise at the same time. And the results with this are even better than exercise all by itself. So examples of this are, I had a patient who, she would go for walks with her granddaughter, and her granddaughter would quiz her about all of the grandchildren's birthdays. And this was something she was emotionally attached to. She was excited about remembering her grandchildren's birthdays. But for some people, it's listening to a podcast and maybe pausing it and then saying out loud what you just heard while you're getting some sort of exercise. Another thing you can do is just learn to do something different. Examples are like dancing, ballroom dancing, hula dancing, learning to play pickleball. There are lots of different things that you can do to engage cognitively and physically at the same time. And what you want to do is be right at the edge of what you're kind of capable of. You want to be engaged. The danger here is that some people, it's not a stroll in the park. You want to be getting your heart rate up where you could be having a conversation, but you're getting enough movement that you're physically engaged. And then same thing with cognition. You don't want to do something super easy or very passive, like just listening to a podcast or listening to music. You want to be challenging yourself and be at that edge, not so much that you give up, but that you're fully engaged. And so being in that spot where you're asking your brain to do new things while you're getting your body to work, we get wildly beneficial effects. So what you see, and this is across the spectrum, again, across the spectrum of cognitive function, everything from no cognitive decline at all, to subjective cognitive impairment, to mild cognitive impairment, to distinct and severe Alzheimer's, we see improvements. So we see a small to medium positive effect when we do this on global cognitive function, just on all cognition. And for patients with dementia, we see that this improves their activity of daily living and has a positive effect for mood. Who wouldn't want that? And these are big differences for people even with severe dementia. And so putting this to work now when you're in prevention mode, there's just no reason not to. It takes effort, but it's totally free. And you'll be exhausted after. It really does take effort. We do it with our residents at Marama. Some things we do, we'll have somebody balance on a ball and we'll have them do math. We'll have them do serial subtraction, or have other math problems, or we'll list the states and their capitals or the presidents in order. So you can do funny little things like that. But I really love when people find ways to make it really meaningful for them. And like my example of a patient who's remembering her grandchildren's, I think she had like 18 grandchildren. There were a lot of them. And so she was trying to remember all of their birthdays was quite a challenge. All right, the other thing I want to bring up is cognition can be severely affected by sleep apnea. So there are a few things that you can do to treat sleep apnea, but the first step is testing it. If you are concerned, if you've been told by a bed partner that you snore, or if you wake up and you still feel tired in the morning, these things are enough, or if you have any cognitive decline, that's enough for me to order a sleep study for any of my patients. And obstructive sleep apnea in particular is associated with Alzheimer's and with dementias, but there are other sleep disorders that can be associated with Parkinson's, like the REM sleep disorders, that can basically be almost a guarantee that you'll be diagnosed with certain neurodegenerative disorders later on in life. So understanding your sleep and how it can be affecting your brain and doing something about it is one of these modifiable risk factors that we can take control of now and make sure it's not putting our brain at risk. So if you think you have sleep apnea, one thing that you could do today is you could go by a Long's and grab mouth tape and just tape your mouth shut, which is totally counterintuitive. It's so weird because you're like, wait, I can't breathe. Why would I shut my mouth? But you want to breathe through your nose. You're going to get the best oxygenation of your lungs by breathing through your nose. So if you're a mouth breather, it's time to see a doctor who can help you figure out how to breathe through your nose. For some people, it takes a more invasive procedure like a palate expansion, or there are even surgeries that you can do to keep your palate raised. I wouldn't jump straight to that, but talking to somebody about your options is important to do right away. Don't put it off. Dentists can make oral appliances that keep your jaw and tongue forward so that it's not collapsing on your airway. For some people, it's just positional. So you can get devices that basically pillows that keep you in place. For a long time, people talked about putting on a vest with tennis balls. Apparently that doesn't work. According to the best sleep doctors I know, that doesn't work very well. But a CPAP or a continuous pressure or an alternating pressure PAP device, those are the gold standard of treatment for sleep apnea. And what I hear from my patients is that the alternating pressure travel version is the most comfortable. They can just feel cumbersome and uncomfortable, but it's worth getting it fit right for you. I had a patient recently who came back after 10 months. And I had initially seen her with her son. Her son was taking care of her, and they lived separately, but right down the street from each other. So he was able to do some of the intervention that we talked about, but not everything. And she had, on her spectrum, she had severe Alzheimer's. We do a MoCA test out of 30, and she had a 6. So normal is 24 and over. 30 is probably what most of you would get. It's a perfect score. But she had a 6. This is severe Alzheimer's. She could not draw a clock. She could not do simple math. She could not remember words or repeat sentences. She had severe Alzheimer's. And 10 months later, the primary intervention that they did was get her on a CPAP. And her MoCA score more than doubled to a 13. And her son said to me, I have my mom back. He described the story of seeing her go into the kitchen. Of course, this is her son, right? So he remembered her growing up cooking, and she had stopped going in the kitchen. She had completely stopped cooking for herself or for him. And he said to me, the other night she went into the kitchen, she grabbed the carrot peeler, started peeling a carrot, cut it up, and then put the carrot peeler in the dishwasher, right where it was supposed to go. She didn't have any trouble finding it. And he was just like, he started tearing up, telling the story, like, my mom can still cook. There's hope that she'll be able to make her own meals, that she'll live independently for longer, and that she's not just going downhill. Her neurologist didn't believe her that her MoCA score had improved so much. They didn't think it was possible. And the primary intervention was treating her sleep apnea. This is a big, big deal. And then we can see it again from the big meta-analyses. This is a systematic review, about sleep apnea and its contribution to Alzheimer's. And it just says very clearly, sleep apnea is associated with a significantly increased risk of dementia, particularly for Alzheimer's disease and also for Parkinson's disease. So don't believe me, it's all in the science. It is very, very clear. And I think it doesn't get enough airtime, that this is something that every person who's going to a neurologist or saying to their primary care provider that they're struggling cognitively needs a sleep study, and then needs to treat any sort of apnea, even mild sleep apnea, aggressively. All right, I want to talk a little bit about toxins. These are things, again, that we can protect ourselves from to prevent triggers that go to our brain that stimulate inflammation. And so in my world, I'm a naturopathic doctor, as my dad mentioned. And so I think a lot about toxicity. Not all doctors do, but I think that this is really important to identify, because I've seen, again, over and over again, patients who are exposed to either mycotoxins, water damaged buildings, or heavy metals like mercury, that just getting rid of that improves their mood, their cognition, their focus, their ability to stay independent, to continue working. And this is a really important piece of the puzzle. Chemical toxins as well. I recommend that all of my patients eat organic so that they're not being exposed to the pesticides and herbicides. Open doors and windows. The solution to pollution is dilution. So like getting good, fresh, clean air into your living and workspaces as able. Really limiting or completely eliminating alcohol, especially if you're struggling with cognitive decline. The alcohol is, I'm sure most of us can relate to having a little too much to drink and feeling like our brain didn't work the next day. The accumulation of that over time is significant and triggers inflammation in the brain. Then looking at personal care products and cleaning products and trying to make sure that they're as least toxic as possible. I recommend not using air fresheners or anything with a non-natural scent. Those scents that go up through our olfactory nerve in our nose, through the cribriform plate, the anatomy is very direct, that those toxins can basically go into the brain and trigger inflammation. And our brain isn't used to registering non-natural smells. So smells from the kitchen are fine. Smells from flowers are great, but pine sol is an unnatural smell. And so we want to keep things like that out of our nose and out of our brain. So how to deal with this? The first thing is to eliminate exposures, and you can do that slowly over time. As you run out of bleach, just don't replace it. Use vinegar and lemon and hydrogen peroxide. Those kinds of things are much less toxic. And then identifying and avoiding, that's our first priority. And after that, it's getting them out. So how do we get toxins out of our system? The accumulation of them triggers inflammation. And this can happen because every cell in our body is eating and creating waste every day. And all of the hormones that we generate, everything going on in our body naturally creates plenty of waste to deal with. We want to make sure that those ways out are open and clear and working. So nobody likes to talk about it, but I'll say it right here, at least one bowel movement a day. That is normal. If you're not having a bowel movement every day, there's something that the fancy word we use is enterohepatic recirculation. You're absorbing from your bowels. And so all of that work that the liver did to clear out the toxins, whether it's metabolic waste or things you were exposed to from the environment, all the work that the liver did, it's going to have to do again if you have fecal matter sitting in your bowels. You really want to eliminate at least once a day, and talk to a doctor right away if you're not. Or if you need to drink more water or get more movement or eat more vegetables and that helps you, do it. Start today. It's so important. And then the liver, we talked about eliminating alcohol, pesticides, herbicides. There's also lots and lots, it's very easy to find online, a liver support product, things like milk thistle and dandelion. There are detox teas that can be helpful, that can give that liver the extra support it needs. And then foods like artichokes and beets and things like that are very helpful for the liver. For the kidneys, you're so lucky to live in Hawaii. I live in Southern California where the water is terrible, but in Hawaii, the tap water is really quite good. And as long as you're not drinking out of plastic bottles, you're probably getting really good water. Plastic water bottles will often have sat in the sun, and then the plastic is melting into the water and you're drinking the water. So avoid that when you can. And then another way to get rid of things is just to sweat. Get hot and sweat these toxins out. we forget about using the breath to detoxify. There are more and more, at least in California, there are more and more of these breath workshops coming up where people can go and do guided breath work, kind of like going to yoga. And that can be a really helpful way to get rid of toxins. It's kind of an underutilized detox pathway. But this is why a cop can pull someone over and take a breathalyzer, is because one of the ways that we get rid of the acetaldehyde or the toxins associated with alcohol is through our breath. And so why not use this pathway to our advantage to get rid of other toxins? It's quite effective. And you get the next benefit, which is the balancing of stressors. So breath work can be very helpful for balancing the nervous system as well as detoxifying. And so you kind of kill two birds with one stone there. So stress has a tremendous amount of impact on the brain. Stress can, of course, lead to anxiety and depression and mental health disorders. It can also put us at risk for dementia. So many of you can probably relate to the experience of maybe stage fright or going through a really stressful period and feeling like your brain's not working, like you can't remember the words or what you were about to say. When you're under stress, our brains just don't work. That's not what we're designed to do. We're designed to be in survival mode when we're under stress, not in cognitive mode, not thinking strategically, not thinking in depth or focusing on something other than survival. So what can we do if we're in a chronically stressful situation is meditation, exercise, and then of course, rest, really prioritizing these things and giving ourselves a chance regularly to take that step back and think like, how can I create a life? There's a lot of choices I make day to day. How can I create a life that has a reasonable amount of stress? You want enough stress. Again, you want to be hitting against that edge where you're engaging cognitively, but not so much that you're getting depleted. So if you are planning on a retirement where you're sitting in front of the TV, feet up, totally relaxed, I would encourage you to find something purposeful and meaningful to do. I didn't tell my dad I was going to say this, but I think that he and his wife actually have made really great decisions about what they want to do as they look towards retirement. And they are really engaged in the orchid community and essentially are getting PhDs in understanding orchids and judging orchids, and they've gotten really into it. And so they have this social network, which is fantastic. And then they also have this cognitive engagement about something that they're excited about. Other people will take up, dogs or they'll start caring for a dog or get a puppy, and that's really exciting to them. Other people will throw their purpose into their family. Whatever gets you excited, finding that new thing and keeping yourself on the edge of that cognitive engagement is so important, where it's not too stressful, but you're getting enough engagement. So PTSD, high stress, puts us at double the risk of Alzheimer's disease, and being the care partner or caregiver for someone with Alzheimer's actually increases our risk by 6 times compared to those who are not caregivers. This is very, very real risk, and it's associated with the lack of sleep, the high stress, the lack of care for our nutrition and exercise that typically comes with caring for someone with dementia. So what do we do about it? There is a phenomenal 12-minute, totally free meditation called Kirtan Kriya. And it is available on YouTube. That is what we do at Marama. You can see on the left there is a small square picture of our residents at Marama doing this. It's just a simple sa, ta, na, ma. So there's an oral component, you're singing, there's a vibration through your system, and then you're putting your fingers together in a sequential order. And it's really fun to watch our residents move in. They like kind of peek and they can't tell if they're doing it right and they're not hitting the right finger. And after a couple of weeks, they're teaching other people to do it. It's really wonderful to watch and see those new connections form in the brain. So this 12-minute meditation, again, meta-analyses, big randomized controlled trials, putting them all together. And what do we see? Just 12 minutes a day of something totally free can improve your sleep, decrease depression, reduce anxiety, downregulate inflammation, upregulate immune system genes, improve insulin and glucose, which we already talked about how important that is to cognitive function, and then increase telomerase, which is what maintains the integrity of our genetics in our cells. So this is there's just nothing that works quite as well as this, except for maybe exercise, right? Meditation and exercise, and I would say diet, these are the biggest things that you can do for your cognition. And it's those decisions that we make every single day that add up to the trajectory of our health over the rest of our lives, right? So it's those daily decisions about what we put in our mouths, what we do with our time, how much we move, whether or not we sleep and meditate. And so I would highly encourage you that's the 80-20. If everyone's kind of familiar with the 80-20 rule, you're going to get 80% of the benefit for your cognition is going to come from those decisions, that 20% down here of the daily foundational practices. I hope that the science catches up with us and that the pharmaceutical interventions become better. But I will tell you that right now, they are not even, what they do at this point, even the new fancy expensive drugs that have come out, they delay the progression of the disease. So you suffer longer. Where the patients that we're seeing, they're actually reversing the disease process and improving the quality of their life. And my hope is that we change the narrative so that nobody has to experience that, or very, very few people have to even go in that direction. So hormonal balance, I am a fan of bioidentical hormone replacement, and this you have to work with a provider on. And I am also a fan of both Krishana and Curtis Takimoto-Gentile, who are in Honolulu, and then also Lori Steele-Smith, who is a naturopathic colleague of mine. Krishana and Curtis Takimoto-Gentile are both medical doctors, but all three of them are very well trained to support you in potentially getting hormone replacement. And there's a lot of controversy, and you want to do a risk-benefit analysis with you and your provider. However, if you are at risk for dementia, if you either have genetic risk or you are noticing cognitive decline, and you have not had cancer and you're not at high risk of breast, ovarian, prostate, or uterine cancer, depending on men and women, then my opinion is that having the support of bioidentical hormones, the benefits outweigh the risks. So I highly encourage it. And I'm a naturopath. For the beginning of my career, I was not as much of a proponent of this, but I have watched so many people benefit. And this is one example of a woman who, highly stressed caregiver, she was taking care of her husband who had severe Alzheimer's. He actually passed away just a couple of weeks ago. I was sad to hear. However, for her, she's going to get a little relief from that stress. She's going to be able to get better sleep. And I'm hoping this MoCA score will go up from 24 to 30. So when I met her, she was at a 20 out of 30. So this is measurable cognitive decline. Remember, 30 is perfect. Anything over 26 is normal. When we're getting in the teens and below that, this is when we're dependent on other people to get through our day. She was at a 20, measurable cognitive decline. And you can see in August of 2021, I ran her hormones. We put her on hormone replacement therapy, and this is 6 months later. Her estrogen is not wildly high. A normal cycling female is going to be sometimes at 200, 300. She just got to 16. Her progesterone, you can see, was at below 1. It was at 0.096 in August, and we bumped it up to 1.7. Her testosterone had been at 12.8, which actually wasn't terrible for someone her age, and we doubled it to about 30. And she had a reduction in stress, she had more energy, and you can see a measurable improvement in her cognition. And so this is a little bit more of the research. I can't wait. The next time, hopefully, I talk to you guys, I will be presenting my own research when it's totally published. As soon as I get off this call with you guys, I'm hitting the resubmit button. We got our peer review comments back about 3 weeks ago. And so the team and I have been working on our resubmission, and I'm going to do that today, which is very exciting. So the next time, I'm hoping to be able to present my actual trial. But these are 2 trials by my mentor. And the one on the left was very similar to mine. It was 25 participants that went through 9 months of the interventions that we've been discussing. And 84% of them, so they all measured cognition at the start, at baseline, and then they measured again at 3 and 6 and 9 months, and 84% of them improved. So this is phenomenal. Like this compared to the Aduhelm and certainly donepezil, the acetylcholinesterase inhibitors, This is phenomenal. These are phenomenal results. No one needs to suffer with Alzheimer's. Now, it takes work to get these results for people to improve, but no one should be told that there's nothing you can do. As I hope I've demonstrated today, there is so much that you can do. On the right, my friend Ram published this, and what you can see here, these are people who had access to the RECODE protocol. So all they did was they got access to an online program, and 51% of them improved. Whereas on the left, these people all had health coaches and doctors. On the right, all they had was access to an online protocol that told them what to do. So you can imagine fewer people actually did it. But still, those who were enrolled in that, 51% of them improved their cognition measurably. So this is orders of magnitude better than what the pharmaceuticals are getting us. And most of it is entirely within your control. And so my recommendation to you is get some of this started today, and please let me know how I can help. I'm excited for fewer people to suffer with dementia. All right, I'm trying to stop screen sharing. There we go. All right, so I'll take questions now. Desmond, will you read them?
Yes, so if everyone can put their questions in the chat box, I will read them out loud for Heather to answer. Oh, also, Heather, Steer, could you put the link to your company's website into the chat as well?
Absolutely. Yeah, so oh, great. You were able to put the keto guide on there. Awesome.
Yes.
Yeah, if you sign up at solcere.com and you put your email address in there, you can, you'll have access to our activities guide, which should be out in the next week or so. We'll update that and send it out to everybody who's on our email list.
Okay, so it seems like we got a question. Will this talk recording be available? Yes, it will be available. It'll be available on our Coffee Hour website. If not today, hopefully by Monday or Tuesday of next week. Just FYI, everyone, tomorrow is a holiday.
Yeah, I'm happy to share a copy of the slides.
Okay, looks like we got a question. I frequently exceeded maximum heart rate when cycling. Do you see any downsides to this?
Greg, that's a really great question. So if you're working with a trainer, they can probably give you more specific guidelines, but it sounds like you're pretty well conditioned. So if you're not just getting started and you've been cycling for a long time and that's where you feel like you're pushing yourself, then I commend you on pushing yourself, and you're probably doing a great job and totally okay. Yeah, I think you're doing good work, and you might want to just get a second opinion from a trainer or a cardiologist. But I think you're probably, if you've made it this far, you're doing all right.
Okay, next question. As to sugar, do you recommend a no sugar diet?
Yes, I do. And no, you don't need to be in ketosis. I don't recommend that everyone's in ketosis forever, typically about 3 to 6 months. But when you come off of that ketogenic diet, if you're struggling with cognitive decline, I recommend about 3 to 6 months in ketosis. If you aren't struggling with cognitive decline, you can get into ketosis for a week or a month or a little while and then come out of it, but go back to it, every 6 months or so. What you want is that flexibility of being able to go back and forth. Now, a no sugar diet, if what you're talking about is a no carbohydrate diet, then yes, that's ketosis. Now, when you come out of ketosis, I still recommend that you avoid highly processed foods and any refined sugar, because those are associated again, in the literature, highly processed foods and any sort of added sugar is associated with risk of both diabetes and dementia. So when you flip back and forth, what I recommend typically going to when you add your carbohydrates is that you add unprocessed carbohydrates like seasonal fruits and maybe squash, starchy veggies like beets and carrots and things that will still raise your blood sugar, maybe even quinoa, brown rice, things like that, versus breads and pastas and candy. I hope that makes sense, Wendy.
Okay, next question. I read that omega-3 fish oil supplements are helpful, but I also heard that it can raise your LDL. Is that accurate?
Excellent question, Lynn. I would ask your provider for an advanced cardiometabolic panel because LDL is not inherently bad. It's really when those LDLs are extra sticky or extra small that they tend to create plaques. And so you want to understand more of the particulars about your type of LDL. Typically, when we add omegas, you get better cardiovascular readings. So you get better cholesterol reading. And even in going into ketosis, what we see is over the course of 3 to 6 months, people's cholesterol levels improve because you start burning that fat for fuel. And so those come down, and particularly triglycerides come down very, very quickly when you're in a ketogenic diet. And fish oil, I have only seen that improve cholesterol levels, especially that Lp(a), which is that what makes them very sticky. So for the most part, what I understand is that's helpful. Now, the caveat there is you never want to take rancid fish oil. So if you smell it, and especially in Hawaii, it's like it gets hot and things are shipped. And so if something's been outside and it becomes rancid, if those oils become rancid and you smell that smell, just throw it in the trash. Not only is it not good for you, it's bad for you. And that would probably raise your LDL and raise your inflammatory markers.
Okay, next question. Is this keto diet similar to Atkins?
Yeah, really good question. So I think the difference in the ketogenic diet is, so yes, Atkins was a very low carb diet, and that part is similar. But what we suggest is very vegetable forward. So lots of leafy greens. And you'll see in this keto diet guide, there is a page that is all of the category 1 foods. It's on page 8, and you'll see all those category 1 foods. It's predominantly vegetables. So the plants are healthy for us. They're so good for us. And the more of them we get, we're getting the benefits of the fiber, the phytonutrients. And when we restrict those carbohydrates, we get the benefit of being in ketosis. The Atkins diet and some ketogenic diets, they're kind of like a bacon and cheese diet, and that's not what we're doing. So it really depends. You can make a ketogenic diet very unhealthy very easily, but you can also make it one of the healthiest things you do because it's an anti-inflammatory diet. It is a detox diet, and it is also a weight loss diet for some people. And then of course, a cognition diet.
Okay, next question. Do you recommend sugar substitutes like Splenda, monk fruit, xylitol, etc.?
Yeah, great question. Okay, so I do not recommend aspartame. That is terrible for you. Please avoid it. So any of the fake sugars, there's a spectrum here. Monk fruit, I actually am a big fan of. Monk fruit tends to be pretty palatable. People like it. It's about a 1-to-1 sugar substitute. You can find it at Costco. It's easy to find. It's easy to use. It comes granulated like sugar. So if you're baking or making something, you can just sub it out. And it's tasty. Stevia is another one that some people really like. It's very, very sweet. It's about 200 times as sweet as sugar, but it has this particular flavor. Not everybody loves it. And it doesn't come granulated like sugar does. So you can't really use it as a substitute, but you can put drops of it like in coffee or tea or something like that. Xylitol is another, stevia and xylitol, they can mess with your microbiome. So be careful with them. If you notice you have stevia and you have more inflammation, more gas, more bloating, if you're noticing joint pain or something changes and you have more symptoms, it may be because you're disrupting the biofilms that bugs live behind. And xylitol is a bug killer. So if you have, this is part of why it's in gum and stuff, but you can kill off too many bugs in your gut. We didn't go into it in detail, but the gut health starts in the gut. And the gut starts in your mouth. And so you want to make sure really good oral hygiene is important. P. gingivalis and the bacteria that cause gum disease, that can directly trigger inflammation and has been found in beta amyloid plaques associated with Alzheimer's. It also puts you at risk for cardiovascular disease, strokes, and heart attacks. So taking really good care of your oral health is paramount to really good long-term health as you age. And xylitol can be helpful for that. But swallowing a lot of xylitol, the sugar alcohols, can disrupt your GI microbiome. You want enough of the good bugs. And so I don't recommend using xylitol as a sugar substitute unless you're just using it in your mouth typically. Christine, I hope that that answers your question. For the most part, all of the really fake sugars like your aspartame, a no-go in my book.
Okay, next question. Any cognitive benefits to cold plunge therapy?
I love this. Okay, so we talked about the ketogenic diet, and we talked about contrast O2. I didn't talk about it in depth, but again, it'll be on that activities handout, some more information about it. And then we didn't talk about contrast hydrotherapy, but all of these are basically the same idea of taking the body and stressing the system a little bit so that we get more resilience. And so, yes, there is tons of benefit to cold plunge therapy. I really love contrast contrast hydrotherapy, where you go from hot, like you're in a hot tub, and then you get in a cold plunge and you go back and forth. What you're getting are vascular benefits because that hot is vasodilating. That's why we get red. Like if you dip your hand in hot water, it'll get red. And then if you dip it in cold water, you shunt, you close off the vasculature. And so you're essentially bringing in blood and shunting it away, bringing it in and shunting it away. And with like a cold plunge where you go underwater, or most of your body is submerged, you're basically taking the blood flow away from the away from the organs towards the extremities, and then with the cold, you're squeezing it back in and just shunting a bunch of blood and essentially like flushing out the blood of all of your organs, including your brain. So when you do this to your whole body, you're getting the benefits of blood flow to your brain. You also, if you've done it, Stefan, you may have noticed that there's like a sense of euphoria around like 90 seconds or 2 minutes. And so you're getting this production of endorphins and neurotransmitters. And you also have, as you do it with other people, you kind of get that sense of accomplishment. And it can be somewhat addictive. But we're getting this hormetic effect. Basically, you stress the system and then you get more resilience. So that's that same idea with calorie restriction. And with the ketogenic diet, it's a fasting mimicking diet. So it fits under the same category of hormesis or hormetic effect. And then the contrast oxygen therapy, where you'd reduce the oxygen, you restrict oxygen, and then bump it back. You go back and forth with the positive oxygen, very similar thing. And then so you can do it with temperature, calories, carbohydrates, and then also with oxygen. And all of these things are really, really beneficial. With the oxygen, sometimes people will combine it with the cold plunge. So the Wim Hof breathing you may have heard of, doing that Wim Hof breathing with the cold plunge you get even more benefit.
All right, next question. If I know I have mold levels from exposure in my home, which has been remediated, I am taking a binder using an infrared sauna and please try to read this out loud a little bit better. And taking glutathione as well as daily exercise. I'm pretty sure I butchered that word, and drinking lots of water. Any other ways to quickly detox?
Well, you've either read the books or you have a really good doctor, because those are fantastic ways to upregulate detox. There are other fun things you could add, like dry skin brushing and rebounding that can help move the lymphatics. You can also get binders. If you're working with somebody who's pretty clued into this, if you know what types of mold you were exposed to, then you can get binders that are specific to the toxin that is created by those molds. So for instance, ochre toxin, there's a prescription called cholestyramine that's very specific to ochre toxin. But if it's like a trichothecene, then you want to do chlorella. So I think that you have a really great foundational, the first thing I would have said is glutathione if you're not doing it, but also maybe some kind of liver detox factors, phase 2 detox factors like B vitamins, maybe like I mentioned, milk thistle, artichoke, dandelion, and the N-acetylcysteine. You're doing glutathione, so I think you're doing pretty well, but you might want to consider like a robust phase 2 liver detox support, and then potentially getting really specific about the binder you use if you have access to one of the labs or provider who can help match that binder that's specific to the toxin.
All right, next question. In terms of hormone replacements, are the ones that a regular doctor prescribes okay, or are there more natural types that are better for you?
Yeah, so my understanding of the literature is that what you want to do is bioidentical hormone replacement. So you can ask your provider, because this is available through regular MDs, conventional providers. Through Longs, you can get a bioidentical hormone replacement. You can get oral micronized progesterone is completely bioidentical. So you don't necessarily have to have it compounded in order for it to be effective or less safe. But I do think that bioidentical is important. And the estradiol patches, those are bioidentical. So you can get conventional medications from the conventional pharmacy that are bioidentical. Just double check that that's what you're getting, because sometimes they're using like the equine estrogens or the progestins, and it sounds really similar, but it's not bioidentical. So again, my understanding of the literature is that you reduce your risk and you basically reduce all-cause mortality, you reduce your risk, you reduce all-cause mortality, you improve bone health, brain health, and cardiovascular health using bioidentical hormone replacement. And for women, this would include estrogen, progesterone, testosterone, pregnenolone, and DHEA. For men, this looks like increasing testosterone. I typically, and also DHEA and pregnenolone can be helpful for men as well. I typically use something called clomiphene or Clomid for men instead of actual testosterone, because that testosterone replacement itself can be associated with side effects like blood clotting, pulmonary embolism, liver issues, and other things. So I use an alternative that basically stimulates testicular production of testosterone instead of replacing it itself, and that seems to have less risk.
Okay. All right. We're going to be taking these last two questions here in the chat. Okay. Next question is how does keto diet affect those with kidney issues?
Great question, Langston. So if you have chronic kidney disease, so you might be noticing that a GFR or creatinine is abnormal. If that's the case, you want to talk to a provider and work with somebody who really knows what they're doing. It doesn't eliminate you from being eligible to get on a ketogenic diet, but you do need to be careful about how much water you drink and how much protein you take in. So somebody's going to want to modify a typical ketogenic diet to have less of those things with your kidneys in mind. But one of the most toxic things for kidneys is sugar, right? So you may have heard of somebody with diabetes who ends up needing a kidney transplant or a liver transplant. High sugar diets are very, very hard on our organs. And so sometimes that means just reducing sugar and not getting completely into ketosis. But just because you have a kidney issue and if it's kidney stones, non-issue, you can definitely get on a ketogenic diet. You just would want to look for oxalates. It really depends on your kidney issue. If you have chronic kidney disease, that GFR, creatinine, or cystatin C is abnormal, then you want to talk to a provider and individualize this.
Okay, and the last question here in the chat. Thanks for your answer. If dealing with male pattern hair loss on a 55-year-old woman will bioidentical hormones help or hurt?
Yeah, really good question. So for any woman who's been pregnant, you've experienced that hair, that full hair when you're pregnant, that is from estrogen and progesterone. And what many women notice is as they age with less and less of that hormone, your hair gets thinner and thinner. Now, if you're experiencing the male pattern balding around the top, maybe the crown of the head, then that can be linked to testosterone. And so what you would want to do is probably use the estrogen progesterone, but not use the testosterone.
All right, I think that's all the questions we have in the chat. Looks like so that's all the questions. Yeah, okay, perfect. All right, so thank you, Dr. Sandison. I'm going to pass it on to Ian, who will give his closing remarks.
Well, thank you very much, Heather, and hopefully all of you will come back for next month's coffee hour, which will be on May 4th. And with that, we'll let you all get back to it. Thank you.
Thanks for having me. Aloha.